Hi, I'm Scott DeBoer. I'm one of the flight nurses from University of Chicago's helicopter team. I'm also the founder of Peds R Us Medical Education.
My name's Troy Amundson. I'm a professional body piercer and EMT.
And as we go ahead and get started, the biggest thing that we're going to be covering is twofold. Number one, Troy, having the experience as a body piercer, is going to go ahead from a body piercer's perspective and show, hopefully, the medical community some tips and tricks to go ahead and make the removal of jewelry a little easier. While Troy is going ahead and removing the jewelry, from a medical perspective, that's going to be my interjections, is a way to hopefully remind the medical community about, you know what, in the vast majority of cases, the jewelry actually does not need to get removed. But if for whatever reason it does need to actually be removed, we hope that this video will help you all make that situation just a little bit easier.
We're going to start with removing a captive bead ring from the ear.
As you take a look at Kaz's ears, it's interesting. People think of just having one singular earring, and then if you can have one, you can have 10, you can have the outside, you can have the inside, you can have little jewelry, you can have big jewelry. The part that actually, when we did the CAT scans and the MRI studies on Kaz to show what does and doesn't happen, interestingly, the biggest culprit in regards to inducing artifact was the ear jewelry.
So to remove this captive bead ring, we're going to insert the ring opening pliers just on the inside, making sure that we're not pinching our patient. And with a little pressure on the plier, it will loosen up and we'll be able to pop the ball out. Then we can remove the plier and the ring will come right out.
What's important from a medical perspective when you're actually removing captive beads, remember that it's got a ring, but it's also got the ball that spins freely on the inside. What's important whether you're removing a barbell or a captive bead, whether it's in the ear, or especially when we take a look at removing tongue or any sort of oral jewelry, what's important is remember that you always have to hold on to the little part to make sure that it doesn't indeed roll back into the airway.
And it's usually easier too to hold on to the bead or the ball with your dominant hand and manipulate the tool with your weaker hand. To aid in the removal of the jewelry, a cotton tipped applicator with a little surgical scrub or a surgical lubricant on it will work. And you can apply that just a little bit on the jewelry, which will help slide it out. Now we're going to show the removal of an eyelet. This is a single flared eyelet. It has a rubber O-ring on the back side, which we'll start by removing the O-ring, and then we can just pull the plug out the front of it. Now we're going to show the plug on his other side. And again, you can just use an applicator with a little bit of lubricant on it. Make sure the jewelry is nice and clean. And this can simply be pulled through the ear. So a patient with jewelry in their nose, you can easily insert a nasal cannula.
May take a little bit of finagling if you've got a fair amount of jewelry in there, but again, cannulas are nice and flexible, and chances are you're able to put it up there and do what you need to do without taking out the jewelry.
And there's plenty of room for it.
If you have something like this, just a quick reminder from a medical perspective, if you've got, like Kaz has with the middle of his septum, if you need to put down a nasogastric tube, if you need to nasally intubate, you know what, chances are it probably ought to come out, because the worry is that you're going to have potential areas of ischemia and subsequent necrosis. But again, if you need to go ahead and do that, as Troy will show you in just a moment, just simply unscrew the barbell in this case, go ahead and slip it out. But if you have jewelry just on one side or the other, and you're going to go ahead and put down a nasogastric tube, you know what? If one side has jewelry, again, just put the tube down the other, and chances are it doesn't need to be removed.
Barbells all work in a similar fashion. To remove these, you just want to grab the ring securely on one side and unscrew the ball on the other.
Now, Troy, do all barbells unscrew on both sides, or are they typically just one side or the other?
Most barbells will unscrew on both sides, although some, especially nasal jewelry or navel jewelry, only unscrews on one side. And this can be just rotated right out. The easiest way to remove nostril jewelry is simply to insert your finger or a cotton-tipped applicator on the inside of the nostril, pushing out gently on the jewelry. That'll give you enough room to get in with hemostats to where you can actually remove the jewelry. So to remove, commonly we'll find a curved barbell in the eyebrow. And again, this works just like other barbells, where you can unscrew the ball. Remove the ball and then just slide the jewelry through the piercing.
And from a medical perspective, unless you have direct trauma to the area, there's very few indications that I can come up with that says, you know what, you really need to go ahead and take that particular piece of jewelry out of somebody's eyebrow.
This is labret jewelry. Again, it works just like a barbell does, but most commonly you'll find this in the lip or in the cheek. And with these, one or both ends will unscrew. Usually the ball will unscrew. This is the same labret jewelry. To remove nipple jewelry, again, this is a barbell. We're just going to go ahead and grab either end of the barbell and gently unscrew it. And then we can just ease the jewelry through the piercing and remove it. So to remove a barbell from a conscious patient when they're sitting up, often you can just ask them if they can remove it for you. Or you can just have your patient extend their tongue, grab the bottom of the ball securely with gauze, and you can just unscrew the barbell and remove it from the tongue. You have to be extremely careful when you're removing jewelry from an unconscious patient. Anything that you remove from the oral cavity, whether it's tongue jewelry, lip, labret, cheeks, anything like that, you have to be careful not to drop the little pieces into the airway. So just real gently, you can open your patient's mouth, reach in and grab the tongue to where we can manipulate the jewelry and unscrew it from there.
So you were holding the tongue with one hand and the big part of the barbell and then unscrewing with the other?
I was just pulled out her tongue far enough to where I could grab the jewelry.
So what we're going to show just real quickly is if you have somebody that has a fair amount of jewelry in their ear, Despite urban legend to the contrary, you can actually go ahead with an otoscope without removing the jewelry and take a look at their ear to indeed see if they have otitis.
So a patient with jewelry in their nose, you can easily insert a nasal cannula.
So we're going to clean this navel first.
Okay.
So for navel jewelry,
You can take an IV catheter, and what we're going to do is just remove the top ball of the jewelry. Again, this comes apart just like a barbell. We're going to go ahead and remove the top ball. We're going to go ahead and take an IV catheter and butt it up against the jewelry. And we can just guide the jewelry right out, keeping the IV catheter in place of the piercing. That way there's no longer metal in the navel, but you'll be able to retain the piercing. Keep it open.
When you're done, you can go ahead and just throw a sterile tegaderm or something of that sort over the top. And as we were talking about earlier, you can use this not only for belly buttons, but essentially anywhere. I'd imagine that you have, what kind of jewelry could you go ahead and use this on, and where on the body, Troy, would you think you could use this if you wanted to keep the hole open?
You could try it with rings, barbells, circular barbells, curved barbells. The biggest thing, or probably the most important thing, is to have the catheter just slightly smaller than the jewelry, as opposed to larger than.
So in theory, you could use it not only on the belly button, you could do it on the nipple, even on the tongue.
Right.
Just anywhere that, again, you're hoping to keep the hole open, but to replace the metal with something that's sterile and also not going to be so much of an issue in regards to x-rays or surgery.
These are the most common types of jewelry that you'll find in your patient. This is obviously a ring. To open a ring, especially at the larger gauges like this, you will need to use tools to open it. You can simply squeeze down on the ring opening pliers, and that will open up the ring, allowing you to pop out the ball. This is a larger gauge ring. Very definitely, you're not going to be able to manipulate this by hand. You're not going to be able to cut it either. So this you will have to use a tool for. And there's not a whole lot of extra room between the jewelry and the tool, so you want to be careful that you don't pinch your patient when you're removing this jewelry. Next is a barbell. This is the most common type of barbell. It's just a straight barbell. With these, typically both ends will unscrew, and you can just unscrew the barbell. Some barbells will have a fit ball on one end that does not move. This is labret jewelry. Again, it works just like a barbell does, but most commonly you'll find this in the lip or in the cheek. And with these, one or both ends will unscrew. Usually the ball will unscrew. This is the same labret jewelry. Here we have curved navel jewelry. This one is typical of a lot of jewelry that you'll find in navels. The bottom ball is fixed, so that gem is not going to come off. And you'll have to remove the ball off the top of it before removing it from the patient. Again, this is just a more simple barbell, same thing. This one, however, both ends do screw on and off. Here we have circular barbells. These work the same way as barbells. Both of these balls will screw on and off, allowing the jewelry to be removed from the patient. This is a thicker circular barbell, and this functions in just the exact same way, where you can unscrew the balls and then remove it from the patient. Here we have nostril jewelry. These are tiny little pieces of jewelry. They can be very difficult to remove if you're inexperienced. The easiest way to remove nostril jewelry is simply to insert your finger or a cotton-tipped applicator on the inside of the nostril, pushing out gently on the jewelry. That'll give you enough room to get in with hemostats to where you can actually remove the jewelry.